What is an ectopic pregnancy? For a pregnancy to occur, an ovum or an egg needs to be fertilized by a sperm. This fertilized egg then attaches to the lining of the uterus. If the fertilized egg attaches anywhere outside the main uterine cavity, it's known as an ectopic pregnancy. The most common location for an ectopic pregnancy is the fallopian tube or the tube that connects the ovaries to the uterus. Rarely, ectopic pregnancies can happen in the ovary, the abdominal cavity, or the cervix, which is the lower part of your uterus. An ectopic pregnancy cannot proceed normally. The tissue in the fallopian tubes or anywhere else cannot support the growth of the fertilized egg. If left untreated, an ectopic pregnancy can rupture and result in severe bleeding. This can be life-threatening and is considered a medical emergency. Early symptoms of an ectopic pregnancy can be similar to those of a normal pregnancy like nausea or breast tenderness. You may experience additional symptoms like light vaginal bleeding, pain in your abdomen, lower back or the pelvic region, or fainting and weakness. If the pregnancy continues to grow and ruptures, it will result in severe bleeding and pain along with low blood pressure, fainting, pressure in your bowels, and shoulder pain. The most common cause for an ectopic pregnancy is that the fertilized egg gets stuck in the fallopian tube. But there might be some hormonal imbalances or abnormal development of the fertilized egg that can play a role. Some risk factors for an ectopic pregnancy are a previous ectopic pregnancy, inflammation or infection such as sexually transmitted diseases, a surgery on your fallopian tubes. In fertility treatments, there's some research to show that women undergoing IVF are at a greater risk for developing an ectopic pregnancy. If you have an IUD in place when you conceive, and smoking. If you think you have symptoms of a ruptured ectopic such as severe abdominal or pelvic pain along with heavy vaginal bleeding, fainting or lightheadedness and shoulder pain, you should seek medical attention immediately. An ectopic pregnancy cannot survive and grow and needs to be removed. This can either be done using medications if you don't have any unstable bleeding or with the help of surgery. After evaluating you, your doctor can discuss the options available to you based on the specifics of your case.